EMTs enter the room already wearing their gloves and eye protection. They are scanning the environment, assessing for the safety of their surroundings.
Hey partner, I see one patient that's unresponsive. Let's start an ALS unit.
Copy. 1607, can we get ALS location?
And I don't see any signs of trauma, so it looks like it's going to be nature of illness call. No C-spine precautions are necessary.
The EMTs are already starting to form their general impression. The patient's level of consciousness is assessed by first verbal stimuli and then painful stimuli. The EMTs shout at the patient and then apply a trapezius pinch.
Hey sir. Sir.
The patient's chief complaint is unresponsive.
Patient's unresponsive.
To begin the primary assessment, the EMTs simultaneously assess the patient's airway, breathing, and circulation.
I do have a pulse.
To assess the airway, look in the airway and listen for any sound coming from the mouth. To assess breathing, watch for rise and fall of the chest. For circulation, palpate the patient's carotid pulse. This assessment should take at least 5 seconds, but no more than 10 seconds. The goal of suctioning is to clear the patient's airway without excessive suctioning, depriving the patient of oxygen. Suctioning longer than 10 seconds should be avoided when possible. After the airway is clear, the EMT measures to ensure the properly sized oropharyngeal airway. This is from the angle of the jaw to the corner of the mouth. The EMT ensures the mouth is open prior to inserting the OPA to prevent damaging the patient's teeth. The OPA is inserted upside down and then rotated 180 degrees to follow the anatomy of the airway. The EMT checks to make sure the patient does not gag on the OPA. The EMT should immediately begin ventilations, as the OPA insertion should not take more than 30 seconds. If your partner has not attached the BVM to high-flow oxygen, that should be done now. The ventilation should be delivered every 5 to 6 seconds, watching for chest rise with each ventilation. The goal of the ventilation is to deliver just enough air to see the chest rise and fall. The EMT will also check for a pulse every 2 minutes.